Welcome to Bariatric Business Accelerator, the podcast created for busy weight loss practitioners and their teams who want to systematize, simplify, and accelerate the growth of their new or existing weight loss practice. I'm your host, Carol Clark, and I am honored and so blessed to get to work with so many different bariatric surgeons, bariatricians, or obesity medicine specialists and their teams to help them in so many different ways. And one of the things that I've been doing a lot of lately is going in and doing some assessments. So either that's an on-site site visit or something that we do remotely, but it's a matter of going in and really taking a deep dive into all the different aspects of a program. And it's a fresh perspective. And while I don't know everything, I do have a knack for finding where there are immediate areas that can provide an improvement in terms of patient flow or financial analysis or some marketing opportunities, ways to grow or systematize or streamline your practice. And I really love this. And one of the things I really enjoy is getting to see some of the trends that are happening across the US, whether it's in a hospital program, an independent program, or wherever it is, whether it's surgical or medical. I love it all. And I have noticed after doing a number of these that there are some trends that I see for some common site visit themes or trends or commonalities that I see. The first one is that, which is very refreshing to me and always very enjoyable, is that the physicians and their teams are so committed to the patients and they're so committed to improving things in their practice and growing their practice. It's very refreshing. I get to meet the greatest physicians, like I say, and their teams. And you can really see the pride that they have in what they've built. And they have all built something great, or we're about to build something to create the vision that they want if it's a new practice for them. But they have a commitment to excellence, and they also know what they want, and they're open to new ideas and recommendations. Most of them are very proud of, like I say, what they've created, which is awesome. It's always a great thing, but they're also open and willing to say, I don't know what I don't know, or share some vulnerability in what is going on in the market, because there are so many changes going on right now in both the weight loss surgery and obesity medicine specialties. So there's so many changes going on, and it is hitting people in lots of different ways, from growth perspectives or perhaps lack of growth, and just creating some confusion for the next step. So that's the first thing I see, is these solid teams that are led by some really great people. And so that's my first theme that I typically see, and it's refreshing because these are the people who are willing and open to change. The second thing that I see is the data that is needed for decision making from a marketing, financial, and just a productivity and planning standpoint is either non-existent or lacking, or it's there, but somebody is not really taking a close look at it and seeing how it can help impact their decisions in their practice. Or perhaps it's something that's inconsistent. You were tracking it, but then the person who was tracking it really isn't there anymore. Or maybe you have somebody who tracks things, but they don't share the data with the physicians or the team. So data can be a big trend or a big theme that is, like I say, oftentimes either helping to grow, but in most cases, it's something that's not being tracked efficiently. And a lot of times we dive into that, and you can helps you make some very educated decisions. So that's the second theme that I see. The third one is that a clear path for growth and a method for communicating and measuring this with your team is not necessarily in place. So many times there are different leaders who have different visions, and so teams can be going in a lot of different directions. And what I find is that when you have good people, they want to do a great job, they want to do the right thing. But if there's not a clear vision and a clear set of goals and ways to measure that, it can get confusing for your team, and it can also create some turnover in your team. So it prevents you from moving in the direction that you want to go. So that is the third thing, is lack of really a clear path for growth and communicating and measuring that, and how to communicate that and measure it with your team. The fourth theme that I see is that processes have become overcomplicated over the years, the big picture tends to get lost, the big purpose. We all know the purpose. We want to help our patients, but sometimes it can get lost in translation. And there's also competing priorities, or maybe a little bit of fear around what's going on in the market or what's happening with your competitors. Perhaps you see somebody online who looks like they're growing a great deal, or you're in the OR and you see someone else's schedule is really full and yours is not, and it creates some really negative feelings. So, but the processes typically can become very overcomplicated, and this makes it very confusing for you. It can oftentimes trickle down into less than desirable customer service because there are so many processes that aren't consistent when they come into your practice. So we like to take a look at all the processes in your patient care pathway, in how you are providing that care, your education, all those different things, and take a look at where we may have overcomplicated things and taken an issue and maybe just threw more staff at it, or we just have kind of overburdened areas of our system. So that's the fourth theme that I see. And the fifth one is too many or too few resources are available. Sometimes there's just a lot of people on your team and there's overlap, or maybe there's a lot of people, but one person is carrying the burden of the work and the other ones aren't. And oftentimes there could be where you're growing at a rapid rate and you don't have the team in place to help facilitate that, or the training in place. And so you can get a lot of turnover for that as well. But these are the 5 main themes that I see. Like I say, I'm refreshed by the people that I get to work with, and those of you out there that are doing just an outstanding job. And that's my first one. The second one is like I say, that data to support your decisions moving forward, maybe non-existent, may be tracked but not implemented or analyzed, or maybe it's just inconsistent. We're talking marketing, finance, and productivity. The third one I mentioned was not having a clear path for your growth and how to communicate that with your team and measure that. The fourth one is processes have become somewhat overcomplicated. And then the fifth one is too much or too little in the way of resources. You may think too much is kind of doesn't make sense, but oftentimes we do in practices throw resources at something before we really get to the crux of what the problem may be. So those are some common themes that I see. I love going in and providing a fresh perspective and just giving ideas. A lot of times when I talk with these different practitioners and their team, inside they know exactly what they want and need to do. They just like to have that added push in terms of getting them over the hump to put these things into place. And it's just always a great thing in terms of doing this assessment with people. Oftentimes we can come up with very simple things right at that time that can help improve what's going on in your practice or in your health system with regards to the services that you provide. In my next podcast, I'm going to talk about the 5 common responses to these themes and how you can take this and turn it into a real positive in your program. So at any rate, I hope this has been helpful. If you haven't signed up for my newsletter, I've got a whole new weekly newsletter. It comes out on Wednesday afternoons, free for you. You can go to my website, weightlosspracticebuilder.com, and sign up. Right at the top, there's a link. And you can sign up for the e-newsletter. Like I say, it's got tons of information for you, easy to digest, helpful for you and your team. Put that to good use. And if I can help in any other way, reach out to me, Carol, Karol, at weightlosspracticebuilder.com. In the meantime, take care.